Hello, and welcome to Aging Matters. This is a show that's provided by and sponsored by the Berks County Area Agency on Aging. My name is Ann Barlet. I'm the Public Advocacy and Outreach Manager for the agency. I'd like to introduce my guest today. To my immediate left is Michelle Jones, and she is the Care Services Director for Co-County Wellness Services. And to her left is Barbara Waller, who is the Deputy Director of Co-County Wellness Services. Welcome, Michelle and Barbara. Thanks for being here on the show today.
Thank you, Ann.
I would like to talk about HIV and the aging older adult population and how it affects them and what some of the situations are currently today and some of the challenges and positivenesses, if that's a word, that's out there for those individuals. I wanted to start because I chose mainly the month of December to have the show because I am familiar with the fact that World AIDS Day is designated every year as December 1st since 1988. And I had to think for a minute, wow.
It's a long time.
It is, it's a long time. It's an international day which is dedicated to raising awareness of the AIDS pandemic that was caused by the spread of HIV infection, and also mourning and thinking and remembering those who have died of the disease. So thought it was a good time for us to think about that and remember some things and share some information. So again, thank you, Michelle and Barbara. You know, I stopped at that date, 1988. HIV and AIDS, you know, we haven't heard a lot, but it's been with us a long period of time. It hasn't gone away, but I think there's some positive things with regards to managing the disease for individuals. And so I think we want to talk about a variety of things today as it relates to an adult or older adult population. First, I think it's important, though, to really share with us information about the services, Co-County Wellness Services. So, Barbara, I'm looking at you. I'll bet you know a bit or two.
Yes, and
Director.
you mentioned 1988.
Yeah.
Well, we go back to 1985.
Okay.
So we were founded as a volunteer group back at that time. And let's just say in 1985, if a lot of you can remember, there was very little known about HIV and why were we and how did we become? People came back to Berks County in order to die. And our job was to help as case management to support the individual and their family to prepare them for the fact that at that time there was the rare example of someone living through this, and it was quite traumatic. So we started in 85 because there was a need. A very simple need, and I won't go into our story, but the person who took that first phone call is still working on our board and with us forever. He's the father of Co-County. We started as Berks AIDS, Berks AIDS Health Crisis. We ended up being Berks AIDS Network, and because we moved and incorporated and went up to Schuylkill County, we are now Co-County Wellness Services. So in the beginning, as I said, people came to us and we helped support them because there was tremendous stigma. And you didn't know what to do, so you weren't being touched. It was absolutely horrible. So we started through that, and we were volunteers, and then we had someone who acted as a case manager, and we started seeing more need and more people coming. And this is an aside, we number all of our clients, and we're up to 2,000 and in the 24s.
2393.
Right. Client number 9 still comes into our agency. So you see, it wasn't everybody's, and that's an important factor. So what we did, we went into Co-County, we continued in case management, and then we realized that prevention was an important thing. So we were in all the school districts because no one knew about it, so you worked with the Red Cross, came up with curriculums that worked well, and we were educating in all the districts. That has morphed away as education and as the disease has changed. So we've been doing this, and basically when we were looking at that, and we were doing HIV testing, and in fact we piloted the rapid test for the state as a small agency. We were the only one doing that, and the others were hospitals. So we've been always active with the state. So we looked at this and we said, well, there's a need. They came to us in 2001 and said, there's not a publicly funded STD clinic in Schuylkill. Hence why we were already up there working, so that's something we did. While we opened that one, we opened the one here in Reading. And so Berks County, so everything we do is free. So we have STD clinics that are available in both locations. And then we step forward and we look at it and say, okay, originally our mission was HIV, but now it's not. It's public health. It's across the board. And so as we went through this in 2012, one of the many surveys that are done found out that in Reading and Berks, we had a huge, huge teen birth rate, double the country. And so we made a group, and we came together, and it was a collective impact. So it was education and physicians and corporations and every mixture of people. And we started this, and it was called Berks Teens Matter. And they made a goal, and that was we rolled it really out in 14, and that we would reduce teen pregnancy by 40% by 2022. And we did that by 2021. Wow. And we continue to have that happening. And that is through education.
I was just going to say, is that all strictly education?
It's education, and we have an HRC, or a Health Resource Center, up at the high school where young people, because people don't like to talk about sexually transmitted diseases or pregnancies, and this gave people an opportunity to get information, not just what your friend says or your whatever. Facts are there, and but we do not give out birth control pills or anything like that. But parents weren't educated. We had young parents who probably no one ever talked to them about it, and there was times in school where a lot of this had been covered under earlier curriculums don't exist anymore. So there's very little public health. So that's what we did and how we expanded in there. And then what happened? COVID. So they said, okay, can you help us? Because you do partner notification. So we ended up doing a lot of the contact tracing for the County of Berks and the case investigation. And then they said, we've got another problem. We have rural people who can't use their cell phones because they don't have cell service. They don't have cell phones. Can you do a phone bank so that you can get information, schedule appointments for people, getting their vaccines. And we stepped up and did that during that point in time. And now we are our little stool, we have our prevention education, we have our case management, we have our Berks Teens, and of course, part of all of that and under prevention education is our clinics. So, and again, everything we do is free. We charge nothing for anyone. So that's where we are today.
And let me ask you, so I'm going to go back to the Berks Teens, the information, the education that you have, is that in one school, all schools? Are you focused on?
The Health Resource Center is only in Reading High School. But we have what we call YAs, which are youth ambassadors.
Oh, okay.
And so, because who better to get the right information from than a teen that's been educated and can do that? It's perfect. But we also have, and so they meet in Reading, but we have a virtual YA program. So it's available to, and of course, it all needs parental consent. But that is done virtually once a month, and so people from different schools. And our ultimate goal would be, of course, to extend this into the different high schools that have needs. Sure. And but we're trying through different groups in the different schools. Sure. And like the libraries, you name it, it's across, because the information has to get out. The parents have to feel comfortable, or those trusted adults that that a teen would talk to. So that's where we are today, and it's just Berks Teens now. We made that change only because the Matter word was being associated on many other things, and we felt that we did not need to do that, so that's why we're Berks Teens.
And we'd be remiss if we didn't say where Coe County Wellness Services is located.
Of course. Our office in Reading is at 429 Walnut Street, so that's right at the corner of Madison and Walnut, so there's street parking there, but and again, you do need appointments. Case managements, you can stop in we will certainly set up an active appointment. Our clinic does have walk-ins on Monday. We take the first 8 people in the door, and then other than that, there's clinic times that are all scheduled like any other
Sure.
medical facility.
And so how do we call to schedule that appointment? What would that number be?
610-375-6523.
Okay.
And we do have a real live receptionist. So, and we are open Monday, Tuesday, Wednesday. We are open 5 days a week, 9 to 5, except on Tuesday we do 11 to 7. So
Good.
people that have work different
conflicts.
shifts, they have time to come in.
Good.
So,
Okay, great. Super. I appreciate that. That helps us to know kind of a little bit of a history and a background, and a little bit more about the focus, your public health focus, the education, the prevention. So as we're continuing that on the continuum of age, we're hitting the older adults, and I hate to say older adults. I like to say adults, but with an increasing age. So I'm in our world and aging, a lot of our programs and services are for 60 and older. So that's where I'm thinking in terms of adults as we're talking about this. And those individuals that are maneuvering here in Berks County, 60 and older, what are you seeing at the Coe County Wellness Services that are happening with adults? Are there differences from back then to today in terms of what you're seeing, what's happening? Do they want more education? Are they having issues? What are the challenges? I'll kind of open it, and I'll let you, if Michelle, if that's your expertise, kind of just tell me, and we can go from there as far as the specifics that you want to kind of direct, whether it's how it's affecting aging, and then maybe some specific challenges or concerns.
We are definitely dealing with an aging population in the HIV world. There is a recent stat from 2022, now this isn't for 60 and above, but 50 and above, that 50% of the 500,000 persons in the United States being served by Ryan White services are involved in care. So 50% of those persons are involved in care, and 93% of those persons are undetected. So 50% of the 500,000 involved in Ryan White services are above the age of 50, and then 93% of those persons are on treatment and are considered undetectable in regard to the HIV viral load.
Okay.
So it's a
We've made some progress,
Yes.
clearly over time.
I would also say that one of the wonderful things that we've made great strides in is the fact that the drug cocktails are no more and regimens are very simplified for the most part. There's always outliers where people have multi-drug resistance, but even in those cases, the regimens to treat HIV are so much more simplified. I would say on the downside, as far as aging with HIV, you have that whole host of things that impact the aging community, but they're amplified sometimes with HIV, including things such as polypharmacy, being on a whole host of medications for maybe diabetes
All kinds
or
of
heart
medical
disease.
conditions.
Right,
Yeah.
and then you're adding on the HIV medications.
So we're seeing a lot more people controlled
Much more,
at HIV.
yes.
And so let's talk about a little bit, if you can expand more on what you've seen over the years with the medications.
Well, and that's
As
been-
you were mentioning earlier, they had
Yeah.
a lot to take years ago. Once they figured out one or two to take, they may or may not have helped. But
It's getting more and more exciting because now we have injectable HIV medications that are very long acting.
oh,
One in
Okay.
particular, there's others that are under investigation and awaiting launch. They've been through multiple trials,
wonderful. Okay.
but currently the most popular, and people probably see advertisements on television, is for a drug called Cabenuva,
Okay.
which is 2 different injections given at the same time, one in
Okay.
each buttock or one in each hip area. And you start out, there's a protocol for it, but eventually once you're sustained on the regimen, it's every other month or 60 days.
Oh, wow.
So the injection will last 60 days, and therefore people don't have to take daily HIV medications.
That's nice. Okay.
In most scenarios. Now, if they're on some kind of a complicated regimen where they're getting the injectable and then they've got some treatment resistance, so they have them on something else. I mean, there's always outlier type situations, but there are more choices open to people in general with HIV,
Okay.
including the aging population. Now, there's a couple of drawbacks with some of the newer things, and there's some positives about it too. One is that you don't have to take pills every day with an injectable. But the other is with aging you can have reduced skin turgor and other problems with one's skin, which makes the chances of an injection site reaction. You can get a reaction from any needle stick, but with these medications, they can be a little tough. People that are familiar that have HIV that might be watching, there was a drug called Fusion, and it was very notorious, even though it was helpful to some people, caused incredible injection site reactions. The newer injectables, they can potentially do that, but much less so. But with a person who is very elderly, like we do have an 80-some-year-old beautiful lady. We actually have two that are over the age of 75, and they are not on the injectable. So I would assume it would be entered into with some caution.
I would think also, if you could clarify, is that so you have to be, probably your physician would want to make sure with you in terms of your own medical condition, whether you're better served maybe with a medication versus an injectable medication. And also, I'm thinking, how does one do that? Can you do it in your home? Is it available for you to get? Do you have other considerations in
That's an
terms of?
extremely good question, Ann, because the current approved injectable HIV medications are not approved for in-home use.
Okay.
They are done in the doctor's office, usually administered by a registered nurse or a PharmD.
Oh, okay.
And it requires that the patient have that follow-up visit once they're established on the treatment once every 60 days, whereas many of our clients, once they're controlled with their HIV, will go anywhere from 3 to 6 months to the doctor. So it does entail more visits, and it is not something that you can just do in your home.
Okay. Well, so there's pros and cons in any situation like that, and it's really having a discussion so you know what works best for you. I know that transportation can be an issue for those just aging, and particularly in our rural parts of our county. It's not, the public transportation isn't as frequent or even available, so that can cause some problems for anybody. And if you already have, your podiatrist and your regular PCP, and you've got this doctor and that doctor, adding one more trip you may want to weigh that a little bit. What about other considerations, other challenges that are out there today in the older population with HIV?
Well, I would preface it once again with something positive, that stigma, there's been a lot of attention paid to that issue in general. So I would say over my tenure at the agency, which is 23 years, I've seen a lot of the stigma reduce. However, there is, like I had mentioned previously, all of the pitfalls that can accompany aging, and aging isn't all bad. You can age gracefully, and there's a lot of beautiful things about aging, but things such as having other conditions such as developing diabetes, or the fact that as people age, a lot of friends might be passing away, partner might pass away, HIV positive or not, and people can find themselves isolated. And so that can be magnified if you have HIV, because even though the stigma has been reduced, you're taking life-sustaining medicines. So say you're a very old person and then we're in the middle of winter and there's an extreme snowstorm and you can't get out to your pharmacy. So a shout out to case management services in general, anywhere, is that when you're linked to case management services and you're HIV positive, I think they're almost critical as you age, as to prevent further dependence, because it helps you stay more independent by linking you to services that can help you do that.
Yeah,
Such
and
as
I agree.
transportation
And we see that all the time. And so I think the acceptance piece, you know, we have senior centers in Berks County. There are 8 different senior centers. You know, that's a place that also we have out there so that we can encourage people to get out of their home. If it's on a public transportation route, to get out there, to enjoy the company of others. And I'm hoping that over time, after all these years, that, as you said, the stigma, the acceptance, I mean, people still really have a hard time going to a new thing. Doesn't matter what it is. It's hard to break in, you know, to go there by yourself, to be, you know, enter a place where there's already people who know each other. So that itself is a problem. And then encouraging folks who do have HIV in particular to feel comfortable also and to be welcome. So you know, with that case support, case management, that might be helpful to them. And again, reminding folks, let's be welcoming to everybody as much as we can as we age, because, you know, we all benefit from that. And through this pandemic, we learned about the isolation being so detrimental in, you know, to everyone, let alone the older adult.
I would say an emotionally sensitive case manager is almost like an initiator for disclosure around HIV. And with someone who's older, especially if they're diagnosed late and they're an older person to begin with, just because of the changes in culture and society over the past few decades, you know, different generations perceive things differently, that it would possibly ease someone into disclosure with a sensitive and compassionate case manager.
Absolutely.
Who can provide facts and information and provide resources and give that person exposure to a non-threatening, non-judgmental environment right out the gate.
Right, because confidentiality is the utmost in all of this, but people don't walk in, and because you are taking a pill, you don't have to worry about, oh my God, if I don't get my pill in now, it's so much easier. They don't walk in with a sign that says I'm HIV, and there's nothing that you look at somebody and go, that's an HIV person. No, not. So it's up to them to disclose, and when they have a comfort level, to do that, because we have people at all ages who will not disclose to their families. I mean, this is a very personal decision that they have to make.
And I guess we only have a few more minutes. I guess I also think, you know, aging and partners and, you know, people have, as you mentioned earlier, survived partners, whether they were, you know, married or not, doesn't matter. They survived partners who have died. They may never have married, and now they're older and looking for that companionship. And I know that, you know, I work with the Attorney General's office for all different kinds of scams out there. And one of those is the romance scam. And there's, you know, online dating and all kinds of things. Are there any issues? I'm thinking that in that kind of line? Or
Well,
are we hearing more about that at all?
From an 80-year-old, who I'm 80.
You heard it, folks. I didn't ask you to reveal it.
But basically, a lot of people, because certainly pregnancy is out the door, and they haven't been sexually active, but one of the problems with aging is that in many cases, HIV is discovered later because it's not something that you're going to get an HIV test, and with that person has not had the opportunity of having the benefit of the medications because it was never done. So as a rule of thumb, if you are a senior and you are sexually active, you should talk to your PCP about getting an HIV test. When you go in, almost everybody goes in for their annual Medicare, their annual this. Throw in an HIV test if you're sexually active, because we will find that more and more. There's the dating scams, but there's people that have moved into senior centers that had lived alone for a long time. And there's all that. And data shows that that older population is usually diagnosed later.
And there's a misconception in the general population by many people that, you know, people get to a certain age and they're not sexually active. And that's really a myth. Because many people are sexually active well into old age.
Exactly. So I think the awareness that still, you know, as you said, we may not get pregnant, but
Well, yeah, that's what everybody's, well, I don't worry. But, you know, in the world of STDs, let's not talk about syphilis, okay? But you can see it's there, and that's something that you need to chat and be open with your physicians.
Thank you for that. We have about a minute left. Is there something in this last minute that you want to make sure that we've definitely addressed here today with regards to HIV in the aging population?
I want to circle back that
Okay.
one of the potential barriers to overall wellness can be benefit issues. And when people are turning 65 and transitioning to regular plans and to Medicare plans, that's another really wonderful thing that a case manager can help with. So,
Okay. All right.
so if people out in the community are watching this and you have HIV and you don't have a case manager and you're older, give us a call.
Reach out.
Exactly.
Yeah, we'll be more than happy to try to answer questions and, you know, give you some support.
That's wonderful. Let's, one of you please repeat again how we reach out by the phone number for Cook County Wellness Services.
Sure. It's 610-610-375-6523.
Great. Thank you. Anything else, Barbara?
I think not. I mean, thank you so much for having us, because a
Thank
lot of people don't want to think about HIV and seniors. They just, you know, and those of us who've been around with this disease for a long time know that we have many older people. So.
Thank you for having us.
Yes, thank you. Appreciate your information. And again, anybody who is interested in having more information, you are welcome also to call our agency, the Berks County Area Agency on Aging, at 610-478-6500. Ask for me, Ann, and I can direct you for that contact phone number for Cook County Wellness Services. At this time, I'd like to say thank you for tuning in to Aging Matters.